British health officials have labelled a coronavirus variant first found in India as a variant of concern due to evidence that it spreads more easily. And Prime Minister Boris Johnson now saying that the situation needs careful handling. The Public Health England has designated this variant B1617.2, one of the 3 variants identified in India that has spread to Britain, as a variant of concern. Surge testing is now being carried out in areas where evidence indicates community spread. Cases of this variant increased to 520 from 202 from last week, PHE has said, and that's mainly seen in London and in the northwest town of Bolton, with almost half of these cases related to contact with a traveller. Now, PHE is citing evidence that it spreads more quickly than the original version of the virus. They say it could spread as quickly as the so-called Kent variant, which, remember, had fueled England's second wave of infections. Well, for more on this, let's go across to Professor Sanjeev Krishna. He's the Professor of Molecular Parasitology and Medicine, Infection and Immunity Research Institute at the St. George's University of London. Professor, first and foremost, thank you for your time. What is a variant of concern? And why has this Indian variant been for lack of a better word, upgraded to this category?
Thank you for having me on your program again, Sarah. It's nice to be here. Before coming on to this variant of concern, I really wanted to also say thank you for sharing those very powerful testimonials just a few minutes ago that you got from some of the frontline workers. My heart goes out in support of what they are facing, because despite the blame and the anger that gets put on them, they keep struggling day after day to take care of their patients. So I think we must recognize their contribution, and we must also look and understand where the failures of leadership have come in India before we turn now just to discuss the question that you've raised, which is the variant of concern here in the UK. Now, you know, a variant of concern becomes a variant of concern when this virus, which is mutating all the time, this virus mutates randomly. The more virus you have, the more numbers there are to mutate, the more mutations you're likely to see. Wow. So that's just simply a numbers game. What distinguishes a virus that is under investigation or a virus of interest from becoming a virus of concern is that some other features in the virus become relevant to looking after patients. So, for example, a virus may transmit more readily. A virus may cause that mutation, a variant of concern may cause more severe disease. Or, you know, and we hope not, of course, but the virus may start to become less responsive to the protective effects of a vaccine. So these are the sorts of things that one looks for before defining a virus as being a variant of concern.
So, has PHE cited evidence for this? Because that is a concern. Is there evidence that this actually spreads more quickly than the original version of the virus?
Well, that's a key question. And the type of evidence at this stage that people collect is how the virus is spreading in relation to the other types of virus that are around. If it looks as though the virus is increasing in numbers perhaps more quickly than some of the other viruses, then it can be, you know, it can start to be considered a variant of concern.
All right.
Now, just to finish, just quickly, you see the numbers are relatively low in this country at the moment.
Yes, 500 cases or so.
When you see virus going up, it's a big increase on a low base.
From around 200 over the week, last week, it's gone up to 5 something right now. Is there any evidence, or has anything shown, has this investigation shown anything about whether it causes more severe disease, or whether it renders vaccines ineffective or less effective or efficacious?
I think it really is, it's early days. Remember that it takes a few weeks before the numbers get to a stage where you can monitor, a disease becoming severe disease, and then looking at the outcomes of that. It takes a long time. And the numbers are relatively small.
So, Professor, this original variant was first detected in October. 2 weeks ago, Britain added India to your red list, means travelers have to quarantine in special hotels. But the move came on April 23rd, but it was announced on April 19th, giving travelers notice if they wanted to change plans, if they want to beat this hotel quarantine. And there are numerous reports in the Daily Mail, etc., of these private flights, private jets being flown in and landing at Heathrow like an hour before this new deadline comes into place. So now that that has happened, how do you put the genie back into the bottle? What is the British government's strategy right now on the ground?
These are powerful points, because what we know about this virus is you've just got to move very quickly in every way to try and tackle it when it starts to escape. And the ways it escapes are when the local numbers are relatively low, as I've emphasized, then the importance of what is coming in starts to become more. And you have to take care of that more. So we go back to the basics always. Vaccinations are an important tool. But while you detect these variants in susceptible populations, you've got to do the standard stuff. You've got to diagnose, you've got to test, trace, isolate. And one other point, which is relevant now, and which is becoming really important in terms of preventing spread or reducing the risk of spread, is ventilation. We know that this is now an aerosol transmitted virus. We've known that for a long time, but it's never really been acknowledged fully. And now it looks as though that is being taken on board. So even in Delhi or in other areas in India, that point is absolutely key.
Masking and ventilation, even if you have to live with take care of a COVID patient. Professor Krishna, last question. Today India has reported for the first time 4,000 deaths. 4,000 deaths due to COVID-related complications in a day. This coming on top of 4 lakh cases for the third time this week, at least. Now, PHE has cited evidence that this virus spreads more quickly than the original version of the virus. They say it could spread as quickly as the so-called Kent variant, which is what fueled England's second wave of infections. That said, what are the lessons that India can learn from the UK experience?
Well, they're the basic lessons that we all hear again and again, but don't hear often enough, and certainly don't reach the ears of leaders and politicians sometimes often enough and quickly enough and strongly enough. You've got to make sure that the chains of transmission are broken. And to do that, you've mentioned 2 methods. We've discussed masks and ventilation, obviously social distancing. It may be very hard to impose lockdowns, but really in this type of crisis, then it's down to individuals to put in these measures to protect their families and themselves. And one point, when oxygen is short and there's very little else that you can do, at least keep the communications truthful, open, honest, and keep educating individuals to make their own decisions. I think these things are absolutely key. Good communication, publishing figures, not suppressing them, communicating effectively, and providing the support structures that are necessary for frontline workers to help deal with this problem.
Professor Krishna, thank you so much for your time. Of course, history will tell. There will be much analysis done of what India did right and what India did wrong, what brought us here. But thank you. Thank you for your time and helping us understand what the concerns are about this new Indian variant.